The Nigerian Medical Association constitutes 7-member panel to assess Nnamdi Kanu's health. Welcome to Biafra News Update. If you are new here, please subscribe to our channel for more updates. The news in detail. The Nigerian Medical Association (NMA) has waded into the dispute between the medical personnel of the Department of State Services (DSS) and a private consultant on the health status of the Biafran Nation agitator, Nnamdi Kanu. The umbrella body for medical doctors in the country has set up a 7-man probe panel to look into the dispute arising between the DSS medical team and the private consultants engaged by Kanu. Lead counsel to DSS, Asiwaju Adegboyega SAN, revealed that the Federal High Court in Abuja on Friday, while opposing the request by Kanu to be transferred to the National Hospital for urgent medical attention. Awomolo SAN said that a team of eminent medical experts across Nigeria has been put in place and has visited Kanu in DSS custody to ascertain the health status of the detainee. While the DSS medical team, led by Dr. Mohammed Nasir, a medical officer with DSS, insisted that Kanu can be properly managed at their medical facilities, Kanu's private consultant, led by Professor Martin Agaji, a retired professor of medicine, insisted that their client must be taken to National Hospital. Professor Agaji, who retired from the University of Nigeria in Nsukka, Enugu, based his recommendations for the National Hospital on Kanu's deteriorating health condition. However, the DSS, which brought in the National Medical Association to resolve the irreconcilable difference on the medical status of the Biafran leader, alleged that Professor Agaji's report was exaggerated and suspicious, especially as it partly recommended some American hospitals. The National Medical Association independent report is being awaited, according to Awomolo in his submission to the court. However, lead counsel to Kanu, Dr. Onyinyechi Ikpeazu, SAN, said his team will not oppose National Medical Association intervention only if such is ordered by the Federal High Court. Earlier, while arguing the application for the transfer of Kanu to National Hospital, Ikpeazu, SAN, predicated the request on Professor Agaji's medical report that Kanu was suffering from a series of ailments that cannot be handled by the DSS medical facilities. He said Kanu would not escape and that the transfer would not pose any security challenge to the federal government-owned hospital, adding that it is in the interest of justice for Kanu to be alive to defend the terrorism charges against him. The request was, however, vehemently opposed by the DSS lawyer, Adegboyega Awomolo SAN, who faulted Professor Agaji's report. Among other issues, the DSS lawyer said that no single medical personnel of the agency was involved in any of the tests claimed to have been carried out by Professor Agaji. Besides, the DSS lawyer alleged that Professor Agaji's unilaterally changed Kanu's medication in utter disregard of the way and method Kanu has been treated over the past 4 years, adding that the report was made in bad faith to send false narratives about Kanu's health challenges to the public. The DSS said that the exclusion of its medical officers, who have been managing Kanu's health without hitches, casts doubt on good faith and credibility of the report and recommendations. Awomolo SAN argued that moving Kanu to the National Hospital will cause chaos and inconveniences for thousands of patients in the hospital. He insisted that the federal government was deeply concerned about Kanu's safety and security. Hence, its opposition to the movement to the National Hospital. The senior lawyer maintained that Kanu would be allowed to enjoy the services of medical personnel of his choice in DSS facilities rather than being moved to an insecure location. He pleaded with Justice James Omotosho to refuse the request and stick to the earlier order of accelerated trial. Justice Omotosho, after taking argument for and against, announced that he would deliver his ruling later today. Thank you for joining us. Please don't forget to comment, like, and share. See you on the next one.